I met Jose Rico, quite a few years ago. How many years has it been?
20.
Over 30 years almost, as a college student actually at Urbana-Champaign.
Congratulations on your new book. You've been doing
you.
incredible work in the mental health field and in the wellness field. I know that we have some shared experience with how we are each navigating that personally and professionally. But we'd love to know in terms of what do you think our city and what do you think our community needs in terms to improve the well-being of our people in the 12th Ward.
So first, I think there's just the issue of access, right? In terms of just not having access to mental health services in our community in particular. So when you look at like our population and you look at both whether it's either private or public services available, they're just not available. So if you want to find a therapist or you want to find mental health support, there are so many barriers in terms of needing to travel, pretty long distances to be able to even access services. And I think one of the things that happen for people that are low income and are on public insurance, the mental health services tend to be more in terms of just overly focused on medication. Right, and not really kind of holistic services in terms of access to therapy or even access to peer support and access to other things out there that we know really help people to kind of move beyond and address some of those issues. In terms of mental health services, they also need to be, and this is one thing that I don't think we have currently, is mental health services that are really truly sort of trauma-informed or trauma-specific.
I was at this event this last weekend, and I've actually attended some of these events in the neighborhood where there are healing spaces and healing centers where therapists, where curanderas, where people go and provide some social work around what are the issues that you are dealing with. But also there's these spaces where not just adults but their children could go and be able to do yoga, be able to learn meditation, be able to find a peer support group where issues around trauma, whether it's street violence or whether it's domestic violence, that in our community they're organizing themselves and they are putting together these events where people like yourself and others that want to be able to create these healing centers. I see so much power in that. How do you see that as a possibility, possibly actually getting public support, because we need the actual public support, but what is the promise of that, of being able to expand the role of using our own knowledge and what we know through our ancestors and through who we are to heal each other and ourselves and each other. Part of my policy platform is the only way we're going to make our communities safer is if we focus on healing the people in our community, right? And so through my work, I've been partnering with about 10 schools in Little Village and Bryant Park, where I've been able to provide funding where there's social workers at the schools, where the parents have exercise classes, where we provide emergency funds for people that are at risk of being kicked out of their house because of a loss of jobs, where parents are learning about emotional behavioral techniques to understand when their kids are acting out. All of these are at schools, which I think with more resources, that's a great place to be able to expand that work that's happening, at Burroughs, at Bryant Park School, over at Hammond School, where these centers could happen at park districts.
Exactly.
Right? Where they could happen at storefronts, where they could happen in all of these places where we already know, in churches, where we already know our community goals.
Exactly.
But we need that integrated services where we provide everything for the whole family. Because the thing that really I see in the work that I've done over the last 5 years in this area is we tend to silo those programs and only see them from a clinical perspective, and we don't actually integrate the whole family and then also see how a yoga, how social work, and how some kind of therapeutic counseling could actually work together. but you've written about that, right? And so for you, this is something that you believe is something that could be possible here in Chicago.
Oh, absolutely, absolutely. I mean, and I think that's one thing that I always felt was like really underutilized, right, in a lot of communities in terms of really building on the strengths that communities already have, like especially our communities here, right? There are already all these strengths, and there already are all kinds of ways, I think, that that in terms of just the culture and families and what people sort of bring to the table already.
Yeah,
right?
and for me, how this hit for me personally was that over a year ago, my son got shot at as he was coming home from school over on California and Cermak. And when we found out, we took him to the primary care physician, and I have Blue Cross Blue Shield insurance. And after his primary doctor made the initial assessment, we were trying to get him to see a psychologist and a psychiatrist to do a more in-depth assessment because he was suffering from post-traumatic stress disorder and he wasn't sleeping. And we called 3 hospitals, and we could not see a psychiatrist for a year. That's when I found out that the mental health services that was closest to me, which is here in Bryant Park, that serves Bryant Park, back of the yards in Little Village, was closed.
Yeah.
And it just did not make any sense to me how a city like ours that has, over 20,000 shootings in the last 7 years, we cannot provide these but these essential services. Essential services to our population.
Yeah.
And that was a second trauma.
Exactly.
Right? Fortunately, I was able to find a therapist that was able to help us. And then it brought up the trauma that I lived when I was growing up in the neighborhood and where I got shot and where all these things happened. That was a big eye-opener in terms of the need, not only the need for these services, but currently the dearth of services that currently exist.
Absolutely. And this happened at a time when, so of course one of the issues is that this happened at a time when supposedly one of the arguments was that other services, other not-for-profit kind of centers could absorb some of the, and of course that wasn't the case. And then you had the closing of some of those centers after the public services had closed because of the fact that they also depended on, state budgets and things like that. So you saw sort of diminished services in a lot of different areas. And then on top of that, an increase for a need of services because of what you're saying. So not only the trauma that people are already living, but then in terms of immigrant communities, the current political climate and what that was doing in terms of increasing, just trauma, depression, anxiety, right? But what people were living on a day-to-day basis because of the sort of uncertainty of our political climate.
Right. So you saw my policy platform around creating this idea of creating funded healing centers in the ward where we're able to bring in psychiatrists, social workers, conflict mediators, people that could really work with an entire family around trauma and around providing healthy practices to be able to deal with some of the issues. How do you think, with your experience, what do you think is the viability of the need for something like that in Little Village, Bryant Park, and McKinney?
Yeah, well, I thought that the proposal was exactly the direction that we need to go with mental health services in the community. So first, again, you have a context where you have, the closing of mental health centers, the public mental health centers, and then in the private sector, also because of issues with budget cuts and resources, there were cuts there. And so you had really nowhere, essentially, that a lot of people could turn. At the same time, you've got communities that are dealing with just a lot of complexities. What I always talk about in my own work is that it's not just about access, but it's also about having this vision for what mental health services need to look like, right? So it's not good enough to just have services if they're not addressing trauma or if they're not culturally responsive, right? And really working from what I call a recovery orientation, right? Which is a much more empowerment strengths perspective in terms of how we work with communities and then also offer communities a range of options, right? So that people have what, folks in the Gold Coast or other areas have, right? Which they can choose to go to acupuncture or yoga classes or see their therapist,
And we should be able to do that too. We should be able to have those services because that's what's really brings us holistically.
Exactly. And really builds on the strengths of the community and our ancestral knowledge and things that people already sort of want to use but maybe don't necessarily have access to unless you have money to sort of pay for those services privately, right? So really kind of this vision that offers much more peer-oriented, community-centered, family-focused, more holistic work, right, that offers people sort of a variety of options for how they can focus on their own healing.